Now, a frozen shoulder is different from a rotator cuff problem. Quite different. It's a bit like saying when people say, I've got the flu, and really all they have is a runny nose and a bit of a cough, which is they've got a cold, and they say, I've got the flu. If you've got a cold, your nose is runny. If you've got the flu, you're sick, you're running a high fever, you feel you're going to die, you're in bed for a week and you're flattened. So saying, a lot of people who have a rotator cuff problem with a bit of impingement say, I've got a frozen shoulder because it hurts when they move their shoulder. Not true. There's rotator cuff problems, and then there is the frozen shoulder. It is a separate, completely specific problem. It involves the actual joint, the glenohumeral joint, the cup and the head of the humerus. And there's a big capsule that goes around that joint, and what happens is, for some strange reason, so we don't know why frozen shoulder turns on, the process turns on. For some strange reason, the capsule starts becoming inflamed, and as it starts becoming inflamed, it starts shrinking down. So it becomes inflamed and it shrink wraps down over the head of the humerus. Now, what this does is completely different from a rotator cuff problem. What this does is the shoulder becomes incredibly painful because it's inflamed, and then you're unable to move it in any direction. So all your movements in a rotator cuff, usually you can make that basic movement quite comfortably, you can still feed yourself, but in a frozen shoulder, the joint, you find that you can't move it anyway, and it hurts even at rest. But as you make a movement, you reach a limit. You can have as much physio as you like, you can go and see whoever you like, a massage therapist and so on. Nobody will change the underlying, because it's deep in the joint, and the capsule is shrink wrapped and the whole thing is inflamed, and there's inflammatory goop inside the joint. It's more common in people who have diabetes. Don't know why. Often people will kind of think, oh, this is killing me, why is it so sore? And then they'll think, yes, and they'll remember some accident they did, which is they lifted something up or did something. But the truth is, when you look really carefully, it comes on for no reason. And its fancy name, its proper medical name, is adhesive capsulitis. The capsule, itis, is inflamed, adhesive, gooped up. So it's just frozen. Okay. Now, what usually happens is it comes on slowly, and over a number of months you lose your sleep, you walk around in a hell of a lot of pain, you can't move your shoulder, and you go and see different doctors who say, yes, you've got a rotator cuff, and someone may try and inject into the subacromial space, which will do nothing. You go and see different other people who can say, yes, we'll move it up, but any kind of work that you get to try and increase the movement just makes it more sore, and you become incredibly grumpy and somewhat depressed with a frozen shoulder. The normal course, because this is a weird condition, the normal course is that over 18 months to 2 years, the inflammation increases, everything becomes gummed up, and then gradually the inflammation turns off, and at the end of 2 years, about 60 to 70% of people will be pain-free. So that's the process. Why it happens and why it does that, don't understand. It is sort of somehow slipped into one of these apocryphal tales that, yes, you've got a frozen shoulder, after 2 years you'll be fine. Unfortunately, that's not the case, because at the end of 2 years you'll be pain-free, but the vast majority of people have quite significant reduction in their shoulder movements and so in function. So that's a big deal problem. And the question